National AIDS STI Control Program Senior Program Officer joining me in studio right now. Good morning, madam. How are you?
Good morning. I'm fine. Thank you.
Great. Greater than Accra. Now, a lot of people have been reading the data, particularly the recent one from the Ghana Statistical Service telling us how many people have had sexual intercourse without condoms or protection, people who are having sexual intercourse with people who are not their partners, and etc. And they want to know, is HIV going up? Is it coming down? What are the latest statistics?
Okay, so good morning once again.
Right.
Before we get to the statistics, there's a reason why we are here today. We are here because we are celebrating gains when it comes to ART, that's anti-retroviral therapy.
We will get to your gains. I want to build the conversation to a point. Right?
Why that? It is because people are still engaging in unprotected sexual intercourse. And for that matter, people are still getting infected. Yes, we can't say the numbers are going up or the numbers are going down, because sometimes it fluctuates, depending upon what you really are looking at, and depending upon the type of population you are looking at it. But for now, what we can say is that for the general population, when you want to talk about the prevalence in the general population, we have 1.7%. That means for every 100 people, you will get about 2 people testing positive. So just look at our population, divide that by the 100, and multiply by the 1.7. And you will see the number that we really are talking about. But where are all these people when we talk about these numbers? When we look at the pregnant women, for every pregnant woman who goes to our facilities, there is the need for this pregnant woman to get tested for HIV.
That's right.
Because HIV, the most predominant way of getting it is through unprotected sexual intercourse. And for that matter, every pregnant woman is at risk of getting HIV because the person has had unprotected sexual intercourse.
That's right.
So for the pregnant women, their prevalence is slightly higher than that of the general population, which is 2%. So for every 100 pregnant women that you pick, 2 of them might turn up to be HIV positive. But the support is not there. What happens to the partners? When the support is not there, it becomes difficult for these women, even though we have the medication to give to them, to get onto the medication, because stigma is still with us. And for that matter, some of them will also go underground. So when you look at the figures that were churned out from the statistical service, when you look at the expected pregnancies that we are supposed to get, multiply that by 2%. Then you would also be looking at the number of positive pregnant women that we are hoping to get. But how many of them turn up at the health facilities? Because for every antenatal facility where pregnant women are seen, people have been trained for them to be able to provide them with testing service. Then for those who are positive, they are put on the ARVs. Because that is why we are celebrating it. We have come from far, and we have reached this far.
Are people confident and comfortable in taking these ARVs?
Yes, they are comfortable in taking it. But you know, for everything that comes new, you need to also look at the fact that some circumstances might not be able to make it ideal for somebody to take it. Because if I happen to walk into a facility because I'm sick, I have another condition, and for the fact that we have made our facilities HIV friendly, so if you enter a facility and you're not tested for HIV, you have every right to question them, because all facilities are supposed to test people who walk in there for HIV.
Every facility.
Every public health facility and some private facilities, irrespective of what condition.
So Kanishi Polyclinic, Adabraka Polyclinic, Kolebu,
Ghana Health Service, we have to put. No, so we call something like entry points. No matter the condition you came with, even if you came to do just family planning, the family planning nurse should be able to test you for HIV. You get it? So if everybody is testing for HIV, then of course, people will easily be put on treatment. We will give a face to HIV. And for that matter, when the medications are there, everybody will take it. But people will go underground. By the time you see them, they've lost weight. They are sick. And for that matter, it will be too late. But when you get tested and you become positive and you are put on the medication and you take it judiciously, you adhere to the treatment, take it at the right time that you are asked to take it, believe me to be, your life will change.
Let's talk about some of the gains beyond, the testing centers that are available. People can just walk in and get tested. By the way, is it for free? Or do they pay a fee?
They don't pay a fee.
They don't pay a fee. It's for free.
Testing, treatment is free. But sometimes when it comes to opportunistic infection, the other conditions that will come in.
Right.
For that matter, you need to have your health insurance.
Right.
And once you have your health insurance, then you will be able to access service fee. It's only when the health insurance will not cover that service. And if it's not covering, then it's not covering for all.
Right.
It's not covering because it's not because you are HIV positive. That is why it is not covering. Once you have the health insurance, any other conditions that come in that the health insurance covers, you'll be taken care of. But ART, HIV testing is free.
Right.
In Ghana.
Let's talk about some of the gains.
Some of the gains. Okay, we'll start from 2003. In 2003, before then, there was nothing like ART. And it was a sad situation for some of us who were in the system at that time. Because you were a health worker, testing somebody, the person testing positive, just looking at the person to walk away because there's nothing you can do for the person. It was like a death sentence for you to get tested and get to know that you are HIV positive before 2003.
It was heartbreaking.
Because there was no health workers and patients. Because if I'm the health worker, I feel helpless.
Right.
I can't do anything. The only thing I can do for you is to counsel you. Just some psychosocial...
When you actually know that, look, this person could be saved, but then there's nothing immediately there for the person to be saved.
Once you test and you test positive, it's like a death sentence.
You're gone.
You are just sitting down, watching the person leave your counseling room. And to you, you don't know whether the person will be able to come back and say, Madam, today this part of my body is where it's paining me. You get it? Because there was nothing we could do about it. But in 2003, when ARVs came in, it was like a savior. Savior not just for the client, but also for we the health workers, because we were going through psychological trauma to see our clients going when we cannot provide them with any other help apart from talking to the person. Who would listen? If I sit before you and tell me you're HIV positive, what else can I listen to when you are talking to me? Because I'm seeing death before me. So it was a gain for us. ART started in 3 facilities as at that time. And as at that time, we had about 100 clients put on ART. But today, as we sit here, we can confidently say that we have over 222,000 clients on ARV. They are doing well. At least, out of that number, about 150,000 that have come up to check their viral load, we've had them with viral suppression. When we say viral suppression, it means you've been able to take the medication. The medication that suppressed the virus in you, brought it down to the level that even if you have unprotected sexual intercourse with somebody, the person will not become infected because you cannot transmit it.
The medicines or the ARVs, are they available readily?
They are available. Because as I speak now, this ART that I'm talking about, and for the over 222 that are cell service, they are cell service across the length and breadth of Ghana. All the 16 regions in Ghana have facilities. We have about 753 facilities providing ART services to these over 222 people. And we have over 6,000 PMTCT sites. When we say PMTCT sites, these are the areas that the pregnant women go for ANC, and that is where they are tested for HIV. So in these sites, when they test for HIV and they test positive, the midwives there also make sure that they are provided with ARVs there. So aside the 753 established ART sites that we have, we equally have over 6,000 PMTCT sites that take care of these pregnant women. Just in case they become positive, they get the ARVs given to them. So the medication is available and it is free. And I'll entreat the general public that HIV is not a death sentence. The most important thing is getting to know your status. And if you are positive, you can go out there and assess.
Madam, the question of stigma, is still around with us. How do we fight it so that it becomes a thing of the past? Because rightly, as you have stated, that people who come, they get tested, they are counseled, and then they still keep it to themselves. They don't want anybody to know because of how society perceives it. How do we go about it?
It is not an easy thing talking about stigma, because stigma has been there for years before even the advent of HIV. Leprosy cases, TB cases were stigmatized. And stigma comes from we, the very people who are with the people.
Right.
Stigma comes from we, the health workers, who even take care of these people. So how can we overcome stigma? Sometimes even the persons living with HIV, they self-stigmatize themselves in the sense that a little talking or something going on somewhere, somebody feels that I'm the one being talked about. We are doing a lot in the sense that we are sensitizing the health workers so that they will be able to accept persons living with HIV. And it hasn't been as bad as it used to be, because the issue of stigma with HIV has to do with education.
Right.
Because if I know the mode of transmission for HIV, even if I have an HIV client sitting before me and I'm just hugging the person, I know I'm not going to get HIV from it. If I'm sleeping on the same bed with somebody who has HIV and I'm not having unprotected sexual intercourse with the person, but just sleeping and my body touching the person, I'm not going to get HIV from it. So most importantly, we need to get that education down to the lowest level, because without the education, the fear is there. Nobody wants to be told that I have HIV. And for the fact that HIV entered this country, and most people thought that HIV was mainly due to promiscuity.
Right.
So it has given it, some sort of cover in that even if I got it through another means, maybe through blood transfusion, what others will perceive about me has something to do with sexual intercourse and nothing else.
Right.
And who am I to go about saying that is not how I got it? So the most important thing is for us to know, both the general population as well as the health workers, to know, because some health workers equally stigmatize general population. So if I'm in the same house with a partner and I go and test, it's difficult. For the men, it's not difficult for them to tell their partners that they are HIV positive. But for the women, because
people think that they went out.
Exactly. But one thing I tell people is that when you were going to marry your husband or your wife, were you a virgin? No. You have ever had unprotected sex before. So if you have ever had unprotected sex, then you are a candidate for HIV. And for that matter, we see people that are discordant. When we say discordant, the one partner can be positive, the other partner can be negative. When it happens that way, and you, the counselor, you don't take care, then you are going to break that marriage. Because it might happen that one had it before entering the marriage, but it will end up like being the person went out and brought it in. Right. So sometimes it's difficult for people who even test for HIV to tell their partners that I've tested for HIV. And once you test and you are having unprotected sex with somebody, then of course, once you are HIV positive, the possibility of passing it on to the person is also there. But the question is, how do I bring this person to the health center or to the hospital?
How do I convince them to come with me?
Because it's scared. The person is scared. What if I say it and he says, pack your things and go? Economically, I'm dependent on that person. How am I going to live the rest of my life? So for females, it's not an easy thing for them to say, I went to the facility, got tested, I'm HIV positive.
Madam, how are we bringing the younger generation along in this educational journey? Because if you look at the statistics as well, you find that a lot more younger people are having unprotected sex, and that could lead them into this domain. How are we doing that for them? For the younger population, what we can say is that, just like I said, all the regions, we have people. We have our community health nurses who provide school health service. And when they go into the schools, they're supposed to give education. Also, these youth clubs that people have, we are equally working with adolescents. Some of the adolescents are even HIV positive, and we have put them together. So they act as support for those other people who are positive, and they also equally give education. And for this reason, for our celebration, we have brought on Miss Malaika. Miss Malaika, for her to be able to tackle those out of school, the youth, so that at the end of the day, they will equally understand. Because for them, most of them, they think for them, they are far away from HIV. Because when HIV came, they didn't know about it. Right. We had HIV in the system before they were born. But believe me, some of them might have been born of HIV positive mothers. And for that matter, they might be HIV positive. So for the youth out there, if you think you've met somebody and you are going to have sexual intercourse with the person, remember the HIV was there before the person was born. And it can happen that the person was born by a woman who is HIV positive. So you having unprotected sex with that person puts you at risk of getting HIV. And for that matter, there's the need for them to use condom if they cannot abstain. The condom is one use. From what you are hearing, some of them wash and wear. they wash the condom and reuse it.
Yes. So condom is single use. It is not washed and worn.
How about female condoms? I did a little, random sampling and they were discussing condoms. And most of the women found it not too cool. Yes.
The female condom.
What do you know? What have people been telling you in your consulting room?
The female condom is there. But it all boils down to negotiation empowerment. Because if I'm a woman, I'm supposed to wear the female condom.
That's right.
The man, you are supposed to wear just one, either the female condom or the male condom.
Right.
If my partner doesn't want to wear the condom and I want to wear the condom, I need to be able to negotiate for condom use. But am I empowered enough to negotiate for condom use? If somebody is economically stable and the person is the one taking care of me and the person says, I'm not going to use condom. So for that matter, the females find it difficult to assess the female condom in the sense that even if I go for it, can I easily use it?
But somebody also said that, look, it's the woman who actually decides if we're going to use a condom or not, because the woman says, okay, where's your condom? And if you don't have a condom, then go and fetch it. If you don't fetch it, then there's nothing. If the woman keeps quiet about it, then it goes on. Is that accurate?
Exactly. And how many women are empowered to say, go and bring the condom?
It's a good question there.
Yes. How many women have the negotiation skills? And for that matter, even if the person hasn't got the female condom, has the male condom to say, this is a condom, use it.
Right.
So we need to empower our women as well to know that HIV is not just about, the man deciding for you, but you also need to take that decision for yourself so that at the end of the day, you would come out and not have HIV.
I ever asked a group of students that I spoke with, I said, look, would you keep a condom in your bag just for an emergency situation? He says, no. That's for the guys to keep. These are female students. The guys to keep. And they are female students. And that's for the guy to keep, because as a woman, if you keep condoms in your bag, people will think that you're a call girl or a prostitute and all of that. Have you heard about that one too?
Yeah, that's what some of them say. And I believe so. Assuming you see a condom in your wife's bag, how would you feel? I can say, just in case somebody wants to even rape me,
right.
I'll say, can you please use a condom then? But will you feel comfortable to see a condom in your wife's bag or your daughter's bag? So you see.
How long will it take for us to get out of this?
How long?
Mindset.
How long? I cannot tell. Because if stigma is out of the system, and if we've been able to give a face to HIV, but yet still people enter facilities and don't want to test. People test and go underground and do not want. They come and test, but they don't want their results. No, they will test, get the results, and they will tell you, I don't believe the results. Or get the results, and that is the end. Get to the ART unit, link there. Then the next thing is, madam, you with your mommy coffee and I'm drink home, you give the person. That's the end. Then they start going to prayer camps and certain until they are sick and they cannot do anything about it.
People believe that there are certain potions and certain concoctions and things that they can bathe with and drink and it will cure
That is
HIV.
what people believe. But for me, coming from the health sector, I believe in the ARVs that we give, and it has proven to us that it works. That is why
and the ARVs are free.
ARVs are free.
And so if somebody sells it to you, it is
if somebody sells it to you, you need to report the person. That means the person has pilfered the ARVs from somewhere and is selling it. But nobody walks into an ART unit and the person is due and has to be given her ARVs and it to be sold to her.
Is that event that's coming up that you want to quickly mark? Then we'll wrap up with that one. Yes.
So we are celebrating ART at 20.
Okay.
In Ghana. We are celebrating our progress, and we are also trying to look at ending the epidemic. Right. How can we do this? We have marked 20 years of ART since the inception in 2003, and we want to intensify awareness of the availability and accessibility of the service so that we'll be able to enhance coverage. Because if the medication is there, sometimes it's disheartening that some of the medications will get expired. But you know that there are people who have tested per our data who are within the system but are not availing themselves of treatment. We want to use this opportunity to showcase for a whole year program that ARVs do work. And we have people who have been on the ARVs for 20 years and they are still going strong. Years back, when we used to get people who have reduced, it's like they are emaciated. As soon as we say such people, they say, I'm sure this person has HIV. Today, are we seeing it? No. Because ARVs have changed the lives of the persons living with HIV, and today they are looking very well. We also want to, advocate for commodity security in the sense that it's a program, and the program is funded. Today, when the funding is not there, how would we be able to provide ARVs? So we are calling on civic societies, those who have the funds, the banks, other organizations that can provide support to support the program, to support Ghana Health Service, so that at the end of the day, we would continue to be able to provide the free ARVs to the persons living with HIV.
Great, Madam. I thank you very much indeed for your time. We're grateful. Madam Winfred Na Okanale Ama Ato, National AIDS STI Control Program Senior Program Officer. And I'm sure if we walk into any of the facilities, we'll be taken care of.
Exactly.
And thank you so much indeed for all the work that you do for all of us. We are grateful. We have to go.